Typically thought, about 10% of ovarian cancer is hereditary due to one gene passed down from generation to generation, placing people at high risk of cancer. Well, now in the last couple of years, we've actually found out this is about 1 in 4. So when you think of every ovarian cancer you see, 1 in 4 has an inherited risk. So what we're doing now is we're able to run something called cancer panels. So what these panels do is it utilizes new technology called Nextgen Sequencing, and it lets us look at 14, 15, 20 genes at a time rather than saying, okay, let's look at gene A. Is this negative? Let's go to gene B. Is this negative? Let's go to gene C. So rather than doing that, we can run all these genes at the same time. This also helps from a family history standpoint because sometimes you have families that are poor historians or they just don't know their family history. So if you think about a breast cancer survivor, we could be thinking, does this patient have a BRCA alteration? Does this patient have potentially Poitz-Jaeger, Cowden syndrome, Li-Fermani syndrome? There's also moderate penetrant genes called like RAD50, RAD51, a bunch of other ones. Well, when you start going through the line, that takes a lot of time. It also becomes very costly. So depending on which gene mutation that patient has, it's going to significantly alter and affect their medical management. So if you don't test the right gene, that family's not going to get a genetic diagnosis. And with a genetic diagnosis, we're actually able to appropriately manage that patient. So knowing, do they need their ovaries removed? Maybe they don't need their ovaries removed, but they need increased colonoscopy. Maybe they need a hysterectomy, but their ovaries aren't at risk, things such as that.